We begin Unit 4 with Chapter 9, which is the shoulder girdle. This is a picture of the shoulder complex. This is comprised of the shoulder girdle, which includes scapula, clavicle, and sternum, and also includes the shoulder joint, which is comprised of the scapula and the humerus. The shoulder girdle is comprised of the sternoclavicular or SC and acromioclavicular or AC joints that allow shoulder girdle motion. These motions include elevation, depression, protraction, retraction, and upward and downward rotation. The shoulder joint is also called the glenohumeral joint, and it's important that you do not get the two confused. The glenohumeral joint is comprised of the scapula and the humerus. This includes motions of flexion, extension, and hyperextension, abduction and adduction, medial and lateral rotation, which are also called internal and external rotation, and then horizontal abduction and adduction. This joint is a very, very mobile joint. There's very few ligaments here, which is why it's often most injured. And 9 muscles are primary movers of the shoulder joint. Here are some of the bones and landmarks that you will need to know for the quizzes and exams. On the scapula, it attaches indirectly to the rib cage. Anteriorly, it is concave and glides over the convex rib cage posteriorly, and it's approximately located between T2 or T3 and T7 or T9. The spine of scapula levels with the 3rd and 4th thoracic vertebrae spinous process, which can help with palpation of either the spine of the scapula or of the 3rd and 4th thoracic vertebrae spinous process. Here's a picture of the resting position of the scapula. As you can see, it is found between approximately the 2nd and 7th rib, with the spine of the scapula lining up with the T3 vertebrae. The vertebral border is approximately 2 to 3 inches lateral to the spinous process. The articulation between the scapula and the thoracic spine is not technically a joint. It is not a joint. The scapula moves over the rib cage of the thorax, but it's not directly attached to the rib cage. Instead, it's connected indirectly via the clavicle and several other various muscles. This helps to provide motion and flexibility to the body. On the scapula, we see the superior angle and inferior angle, and these are all going to be landmarks of the scapula that you will need to know, as well as be able to palpate. This will provide you with the knowledge of how to palpate different muscles, and also where to know if different dysfunctions are occurring in these muscles. So be sure to pay attention at what view you are looking at, whether it be the anterior, posterior, or lateral view, as you see here on your screen. Next, we have the vertebral border, and then the axillary border, the spine of the scapula, then the acromion process, the glenoid fossa, and finally the coracoid process. Pay attention to the different muscle attachments that you see on the previous slides and this one, as they can come in handy for studying. Next, we're going to cover the clavicle, and here are the landmarks of the clavicle that you will need to know. Again, be careful to make sure you see which view you are looking at. For example, on the screen you see the superior view and the inferior view. Also, for the clavicle, make sure you understand which end you are looking at, whether it is the sternal or the acromial end. Here are the landmarks of the sternum. The superior end provides attachment for the clavicle, and then along the sternum you can see the various attachment points for the costal cartilage of the ribs as well. The sternoclavicular joint is the only direct attachment to the trunk. It is a synovial plane joint, and motions occur in 3 planes, accompany the shoulder girdle motions. Here's a picture of the sternoclavicular joint. So this is where the sternum meets the clavicle. There is an articular disc that serves as a shock absorber and contributes to joint motions as well. It helps to increase the size of the joint surface and helps to block medial movement of the clavicle onto the sternum. For some people who have had injury to the collarbone or clavicle, the disc can become displaced slightly, causing a sensation or an audible pop every time somebody is able to move